Well, officially welcome to this edition of the People's Parliament, Kabarole edition. We went to Mbale, we went to Lira, and now we are here in our final destination of Kabarole district. But this time around, we want to focus on the power dynamics that affect the water, sanitation and hygiene sector. Gender inequalities that are rife within our communities. How are they affecting women and girls when it comes to access to water, sanitation and hygiene? Around 2016, it was discovered that young women and girls in Uganda here were spending over 200 million hours just doing what? 200 hours doing what? Fetching water. And of course, that took away the time that they would have focused on education. We also do know that from a survey conducted in 24 sub-Saharan African countries, it was discovered that when girls are sent to fetch water for more than 30 minutes, it actually affected 3 million children and a whopping 13 million adult females when it comes to fetching water. That is if your home has no piped water and the girl has to walk a longer distance to go and fetch water. So it affects them a lot. Many of our young girls have dropped out of school, 86%. That's not a small number. So the power dynamics, gender inequalities, how are they affecting our young girls and women in our societies? So that's why we are here on this People's Parliament Kabarole edition. Allow me invite Ms. Jensen Buche, the Country Director of Water Aid Uganda. She's going to break down the nexus between gender and the water, sanitation and hygiene sector within this country. Hello there, Jane. Good evening. How are you doing? Indeed.
The Speaker, good evening all. It's really a pleasure for me to be standing here once again in Kabarole. As Water Aid, our focus is water, sanitation and hygiene. In reaching everyone everywhere by 2030. When you look at the statistics that are out there, where in Uganda you have 20 million people without access to basic water services and 34 million people that don't have access to a basic toilet, a toilet that will allow them to properly go in and ease themselves and to have safely managed services. You have 34 million Ugandans that don't have access to a basic service. You have another 33 million Ugandans that don't have access to good hygiene practices or services where they can be able to practice and prevent diseases. Now, this is what, as Water Aid, we are focusing. We want to have everyone everywhere by 2030 accessing these services. Now, the nexus between gender or women and girls and WASH, I think it's a fundamental element that we need to be able to put out there. Yeah? So many women and girls are facing these challenges because they bear the greatest burden of inequalities to WASH access. If I were to start and look at the cycle of a human being, and particularly focus on women and girls, it starts at birth. If we look at the cycle, let us start at the birth phase. When a child is born by a woman, there's a lot that requires WASH. You cannot give birth where there's no water, where there are inadequate sanitation facilities. In Uganda, 336 women per 100,000 live births die. Every day, 33 children die at birth, neonates. These are children less than 1 month. And contributing factors are these WASH services. It also impacts on the ability of women when they are pregnant to go to healthcare facilities to get services. Because why would they go to a healthcare facility if there isn't adequate water or sanitation facilities? They would rather give birth at home. Post-birth, when the child is growing up, less than 5 years, we know the rates for malnutrition are high. And what contributes to this? Diarrheal diseases. What is the contributor of diarrheal diseases? It is poor hygiene, drinking water that is not safe, or sanitation facilities that do not allow the disposal of such waste. And our under fives are facing malnutrition. And in the world, 50% of malnutrition or undernutrition is attributed to WASH. Yeah? But still, when they're in school, our girls reach puberty and they start menstruating. And when you're menstruating, you need to have services that allow you to be able to maintain yourself. Yeah? When you look at our schools, these services are not adequate. Beyond puberty, a girl has finished school or has gone into the communities and is generating or practicing income-generating activities. But they are in a compromised situation when you compare them to the male counterparts. And where does this put the country? We know that women are more than men in this country. And we know that we want to get to 2040 for income generating in terms of middle income. Now, how do we get there if more than half of the population is not able to actively engage in economic activities? So this is where, for us, we really want to put this out there in that, yes, we know as a country, in terms of realizing the WASH target, we are not there, but let us put an extra eye on the women and girls, yeah? Because to be honest, where would the world be without women? So today, Speaker, I really want to emphasize our ability as a nation, but as Kabarole, what is it that we're doing to ensure that our girls, that our women are getting rid of this chronic problem and challenge of WASH? And this is for the betterment not only of Kabarole, but the betterment of the nation and the world at large. Thank you very much.
The country director for Water Aid Uganda, and indeed the statistics are bare. 200 million hours spent by our young girls in 2016 fetching water. How many years ago? That's 7 years ago. So now are we saying they've been spending like 400 million hours fetching water, especially during the COVID-19 pandemic from 2019 up to date when we were under a lockdown? During that period, how many hours were being spent by these young girls to simply go and fetch water while the male counterparts were somehow learning online? So they indeed left these young girls behind. When you look at Kabarole and their health centers, let's break down some of the statistics here. We do know that 21.3% of the health facilities within Kabarole district have no access to safe water. And we also do know that a whopping 66.0% have basic access to water services within this area, and 12.8% have limited access to safe water sources within this jurisdiction. So indeed, there is a lot that needs to be done. Globally, we are talking about nearly 2 billion people having no access to a safe drinking water source. Let's bring in, that is Honorable Richard Rwabuhinga, the LC5 chairperson for Kabarole District, to talk about the status of the water, sanitation and hygiene sector in Kabarole District.
Thank you very much, Mr. Speaker, and good evening, viewers. Richard Rwabuhinga is my name, and you are most welcome to Kabarole on this edition of the People's Parliament.
Thank you.
Here at the district headquarters. Viewers, Kabarole District is a district of 316, a population of 363 people who are spread in 362 villages, in 52 parishes, in 15 lower local governments, 10 of these being rural sub-counties, and 5 being town councils. Concerning the water coverage, our facts are as follows. The safe water coverage stands at 78%, and the level of functionality stands at 82%. The latrine coverage stands at 92%, but the quality of these latrines is seriously wanting. And therefore, realizing these challenges in the WASH sector, water and sanitation, as a district, we partnered with our friends, IRC, International Water and Sanitation Center, and we set up what we call a district WASH master plan. Now, this master plan informs the planning, informs the costing, informs the allocation of resources to address the challenges that we do face in this WASH sector. It was put up in 2018, and it runs for 12 years. It is 2018-2030. Our desire is to have, by the year 2030, every household being able to get water within their compound. Our desire is to have every person in this district being able to access safe, clean, and piped water within the reach of 100 meters. Just the low-hanging fruits that we have achieved since, about 7 schemes have been established since 2018. Among them is Kiko scheme, Ruetera scheme, Isunga Kasenda scheme, Harugongo scheme, Kabende scheme, and in Mugusu we are partnered with an organization under the Ministry of Local Government called LEGS. We have an investment of about 880 million Uganda shillings to upgrade this scheme to acceptable levels. But we are also renovating. We invest a lot in operation and maintenance. Even last week, I think, we were signing off some contracts to do operation and maintenance of the other water sources that had become malfunctional. And we are also interesting other partners. That aside, we have challenges. The bigger challenge is the planning in this country. Being a decentralized country, operating under a decentralized system, the ideal should have been that we do a bottom-up planning. We identify our needs, our gaps in WASH, in the water sector, in the sanitation sector, and we tell the center that this is what we want to achieve and this is the cost. But to the contrary, the center gives us indicative planning figures. So you go plan within these ceilings. Now this planning is wrong because it does not provide a leeway. It does not provide an opportunity for us as actors in the local government to make our independent plans. We have certainly to fall within the ceilings central government has provided. Going forward, our desire would be that the central government gives us an opportunity, the Ministry of Water, the Ministry of Finance, to identify our gaps in water, to identify our gaps in sanitation. We budget for them, then we say this is our budget that we need in the given financial year. But if we remain the way we are, yes, we love to serve our people. We are progressing. The master plan is informing our planning, but we remain with the bigger challenge of the financing gap and the planning gone wrong of the up-bottom planning rather than the desired, which is bottom-up planning.
Talk to a community member, that is Stella Kajoina, to give us a brief account of how she's been struggling with access to water in her community.
The women, what we are facing, some waters are contaminated by animal wastes.
Animal wastes?
Yes.
Like the herders bring the animals to the same water sources that you use?
Yes.
Ah, I see.
Then there are also chemicals. For example, in my sub-county Kichwamba, there are those ones who deal in pozzolana. So those chemicals do spoil the water also.
Wow. Go ahead.
Some water are also, some waters are also not protected. In a way that you find water, it is just open, whereby people are now getting what? Bilharzia. In Kichwamba, they are supplying bilharzia gund tablets. So it is a problem also. Scarcity of water in some areas in Kichwamba sub-county. For example, Kihondo parish has water, Bwanika parish has no water. So some areas have, some areas don't have enough water. Then in as far as what is the role and responsibility? My role is to sensitize the masses of people in my sub-county, to make sure that all the people in the sub-county or in the area have responsible over the water uses, involving both men and women in collecting water. For example, in our sub-county there, you find if they see a man carrying a jerrycan of water, they will say, that one has been bewitched. So men are fearing and not helping us in doing that. That's what they
Stella, before you go, LC5 chairperson, Honorable Richard, says access to safe water is at 78%. Is that true? With what you're saying on the ground, in the community?
It is not true.
It is not true?
In my community. For example, I'm talking of my sub-county, Kichwamba.
Yes.
Whereby Bwanika Parish, it is now 13 years, we have never received water. But in Kihondo Parish, water is there.
Wow, thank you so much, Stella Kajoina. She is a community member. She has a lot of information when it comes to access to water. And indeed, you're still watching the People's Parliament. That's why we are here, to share statistics and so that we can get the facts out to the fore, so that you can help the people of Kabarole and the whole country as a whole. Romeo Busiku is my name. I'm your speaker for this session. Let's take a break. We'll be right back. Don't go too far. Welcome back, and many thanks for staying with us right here on the People's Parliament Kabarole edition. We are talking about the power dynamics that come into play when it comes to the role played by women when it comes to access to safe water. What are the power dynamics at play, the gender inequalities that are affecting the water, sanitation and hygiene sector within this country? 20 million Ugandans still have no access to safe water. So indeed, let us talk to, that is the Chief Administrative Officer, Mr. Swaibu Balaba, to get into this next segment. Mr. Swaibu?
Kabarole District Local Government is privileged to have funds that are provided for by government and funds provided for by our partners. Kabarole District Local Government, as for this financial year, was allocated 843 million shillings, 451,000 for water.
Nearly 900 million.
That one financial year. And that fund that was allocated to Kabarole District Local Government is guided by the policies of government. In allocation, 75% goes to development, 15% rehabilitation, then 10% for investment service costs.
Where is all that money going?
We follow those policies and we use this money. Now, for this financial year, we have put 256 million shillings extension of water to Busaiga Parish.
Your camera is there.
We have also allocated funds for extension of water to Isunga. We have allocated funds for extension of water to Chamazima. We have allocated funds for extension of water to Munisha. That is in Ruengaju. The other one was Harugongo, Kasenda, Busoro, then Ruengaju. Then we are rehabilitating 15 shallow wells. And this is in line with the policy of government. How much money was sent to Kichwamba? Kichwamba sub-county for this financial year, we are not handling Kichwamba under this financial year. But the other previous years, Kichwamba was handled. And I'll be able to give you the figures. We allocate according to the need. Kichwamba has a grafted flow scheme which has issues which we are going to handle next financial year. So we cannot be everywhere. We cannot be everywhere in one financial year. We have priorities. Those that have a lot of need, we address their needs each financial year, given the resource envelope.
You said Kichwamba has a gravity?
Yes, a grafted flow scheme that was made in the previous years, but it has rehabilitation issues, and we are going to address that next financial year.
Is that true, Stella? You have a problem with your gravity flow scheme?
Yes, we have been patiently waiting for it. They are promising us day and morning that they will work on it. Up to now, they have not worked on it. They are telling us there are issues. When will those issues end? So we want to know those ones.
When will the issues end? Mr. Abuhinga.
Mr. Speaker, in her presentation, Madam Stella, who is my voter from Kichwamba, acknowledged
Indeed.
that they have water in a parish called Kihondo. I think she did submit. So it is true that there is a gravity flow scheme in Kihondo yet to be expanded to cover Bwaneka Parish, and in the next financial year, we have provided 217 million to cover one more parish called Buhara in Kichwamba Subtown. That is effective July this year, the next financial year. But the gravity flow scheme in Kichwamba is in existence, although not covering all the 3 parishes of Kichwamba.
Indeed.
That's the information I wanted to provide.
Stella Kajoina, help is coming real soon as far as July.
Thank you so much. And in line with the government policy,
Go ahead, Mr. Swipe.
in line with the government policy, we are supposed to provide at least 1 clean water source per village.
Indeed.
That's the policy.
Per village.
Per village, 1 clean water source per village. But as we talk now, some 62 villages are not yet covered. But we are moving there
All right.
as government. Then 2, we are supposed to have water being fetched at least in a distance of,
Face the camera.
okay, water being accessed in a distance of around 500 meters. But Kabarole is fighting to bring it to 100 meters.
Indeed.
So that people can access. And this is rural water. There's a difference between rural water and urban water. So rural water is 500, but for us, we are reducing it to 100.
Lastly, Mr. Swipe.
Lastly, we intend to ensure that we have piped water
For every home.
for every home, as chairman put it. And 2,
Do you have a timeline?
We're encouraging institutions.
Do you
and
have a
people-
timeline as to when you intend to have piped water for every home?
2030.
2030. SDG 6.
Yes,
All right.
that's what will be.
Thank you so much, Mr. Swaibu Balaba, the Chief Administrative Officer. We still have another segment of recommendations. We'll have to call you to give us some few pointers on how to rectify this situation. And of course, the next person in line is Mr. Chisembo Brian, the Assistant District Health Officer for Kabarole District, representing Dr. Kalyejira Stephen, who is not going to show up today. Thank you so much for coming through. Indeed.
Thank you so much, Mr. Speaker. Good evening, viewers. Some of the challenges that we are facing amid these other interventions as a district or as a department, mainly are under planning and budgeting. One is already chairman has alluded on it.
Yeah.
That is the top-bottom approach of planning.
Which is not working.
So, which is actually not working because the budget ceiling that we are given versus the set standards. For example, the infrastructure of WASH, we are supposed to be having probably the bathrooms, they have a standard size, the doors, the rails for supporting women to sport. So all those will be missed out when it comes to negotiation in terms of implementation of the infrastructure due to the budget ceiling.
21.3% have no access to water. What do you have to say about that?
So we've worked out, it is very true, and one of the ways that we've tried to improve, according to that report, we've improved. That has, we've worked out with the partners. And as a district, we have the WASH master plan that we are focusing on. Because previously, we didn't have an operational tool that would guide us as a district. So by coming up with the WASH master plan, we're able to prioritize areas.
Break it down for us, the WASH master plan.
So in the WASH master plan, we are actually focusing on on planning and budgeting. Then number 2, we're also looking at prioritizing the areas that we need and the services we need to give out to the communities according to the need. Then 3, we're also looking at partner coordination to avoid duplication of work, and yet they are providing us with a number of funding.
Indeed.
Yes.
We've run out of time, Dr. Chisembo, but then there is a very crucial issue, the factor about E. coli in your water. Please address it. It's making people sick.
Yes. So
what is E. coli, first of all?
The E. coli is a bacteria, and this is normally found in fecal matter of human beings. So when it is found in water, it is a clear picture that actually people are now consuming this bacteria, that in certain amounts it causes disease. So this is, the speaker is actually articulating it very right, that in some, when we did the analysis of the water in our health facilities, and also in our communities, some of the water contained E. coli, this bacteria. But however, in some of the water supplies, it was in low permissive levels that would not cause disease. But what we are doing for us as a district is now we are strengthening on the water quality testing parameters at all levels.
Indeed.
Yeah.
Thank you so much, Dr. Chisembo. You've been so helpful. Indeed. All right, he's representing the District Health Officer, that is Dr. Stephen Kalyejira, who did not show up today. But indeed, you represented him so well. Let's now take this opportunity to usher in Martin Watsitsi, my brother from Umbale. He is representing IRC WASH in that regard. We'd like to know how civil societies can better coordinate or build synergies around WASH in targeting increased access for most of the vulnerable communities.
Thank you, Mr. Speaker, and thank you and good evening our viewers of the People's Parliament. Mr. Speaker, I'm from Umbale, but I'm in Kabarole. So I would like to address most of the issues based on the perspective of Kabarole district, where I reside, where I work, and where also my organization, IRC, that has been mentioned, also supports this district on issues of water, sanitation, and hygiene. As civil society organizations, we do support government to fill in those gaps that government is unable to fill, but we are not designated as service providers. Government that collects taxes from the citizens still bears the duty of being able to provide the wash services, the water, sanitation, and the hygiene services. So we just complement government where it cannot reach. So we should definitely be well coordinated with government and ensure that government takes the lead. As civil society organizations, we have supported the government, the district local government, to come up with the coordinating tools. For example, the master plan has been talked about. It's a government document, but supported by the civil society organizations. Mr. Speaker, I would like to hand 2 books to you, which here are guidelines for WASH in healthcare facilities. And this is also a government book, which is the micro-planning handbook, supported by WaterAid, UNICEF, and other civil society organizations to come up with them. So what our call is that this information should not be printed and gather as dust, but should be put to effective use. In that document, the small book indicates that Kabarole district would need $2 million to have its 21 healthcare facilities at least have adequate wash services.
47 healthcare facilities.
Yes. Have adequate wash services that are described as basic.
Indeed. $2 million.
$2 million.
Wow.
So what we would wish to hear from government, that maybe council has passed that this is the allocation from the 2 million. We are following this guideline of government that the $2 million we have allocated maybe 500,000, and progressively they are looking at achieving that. The important bit that is contributed to by the civil society organizations is to help and define these issues. When we talk about water, everybody will tell you that water is life. But people are not dying or falling sick because of water, because of lack of water, but they are facing challenges because of the bad water
Quality.
that they are. So the water that we are talking about is that quality that comes from an improved water source. That there has been some level of improvement to safeguard this water from the contaminations that the district health officer has talked about, issues of E. coli. The citizen of Kichwamba mentioned bilharzia, among other challenges. The unfortunate bit, and this is a call to government, to also help us as a civil society and probably waive taxes on the services that we are providing.
As IRC WASH.
As civil society organizations.
Perfect.
We use funds which come from taxpayers in other countries, but when we are providing services, complementing government efforts,
You're still heavily taxed.
again, we are tasked,
Martin,
and that
Watsitsi,
becomes a challenge.
representing
Thank you very much.
IRC WASH. Thank you so much, sir, for the information you've divulged today. You know why I'm so happy about the information he has divulged today? Because he says we need $2 million for Kabarole. Guess how much you're receiving so far? Between 200,000 to 250,000 US dollars. That's what you received. Between 800 million to 900 million. It's too little. Where's the rest of the money? Where's the $800,000? $1.8 million, in fact. Where is it going to come from? And without that money, we cannot talk about 100% coverage for the whole of Kabarole when it comes to the water, sanitation, and hygiene sector. So indeed, let's talk to Asaba Shadrach, Water Committee, that is a Water User Committee representative right here. But that is going to be after this short break. You're still watching the People's Parliament, Kabarole edition. Let's take a break. We'll be right back. Don't go too far. We'll be right back. Welcome back, and glad you're still watching NTV Uganda, the People's Parliament, coming to you live from Kabarole district right here. My name is Romeo Busiku, and I'm more than excited to be in your midst. We've been talking about the water, sanitation and hygiene sector in Kabarole district, majorly focusing on the access to water bit. But now, let's also talk about sanitation. We do know that 10.5 when it comes to access to sanitation within this area, 8.5 have no access to sanitation facilities. 8.5% of the 47 health facilities within Kabarole district have no access to sanitation facilities. We also do know that 76.6% have limited sanitation facilities. That's a big number. Imagine 76.6% of the healthcare facilities in Kabarole have limited access to sanitation facilities. That is really, really deplorable. We also do know that 10.6% have only basic access to sanitation facilities, and only 4.3% of the healthcare facilities, the 47 healthcare facilities, have access to advanced sanitation facilities. So indeed, these are very deplorable statistics that are coming in from the Ministry of Health. We do have another gentleman who is waiting in line, Asaba Shadrach. He is a Water User Committee representative, and he also has some information for us with regards to the water, sanitation and hygiene sector in Kabarole district.
Speaker, the viewers, good evening. In line with your question, but I will first give my experience a little.
Indeed.
Yes.
Much obliged.
When it comes to water, when we are providing water sources,
You're going to face the mic?
Yes, one of the issues that we put in mind is, like you have said, equal distribution. In line with your question, the second critical requirement in the policy for the 6 requirements
Face that camera.
says women in meaningful involvement. What does that mean? That the composition of water user committees shall have at least 50% of the women. Then women should take key positions in the water user committees, that is chairperson, secretary, and treasurer. Now, water point attendants shall also be women. For example, we have caretakers, and we have schemes like the chairman, LOC5 said, and somebody from Kichwamba, that we allow even scheme attendants to be women. And where at times we see that they are shying away, we kind of try to separate dialogue with them such that their issues are brought.
I feel like the problems affecting women in Kichwamba are largely because they're not involved in the leadership process of water management.
Since it is not my actual sub-county, I may not answer it that way, but if I look at
Your sub-county.
Kasenda, my sub-county,
Yes.
yes, if I look at Kasenda, my sub-county, it is only that they shy away to the point of telling you that we try to separate and have their views come out. Otherwise, if they were coming out brilliantly, that would be no problem.
Thank you, Asaba. And finally?
Finally, we have school health clubs. Our IRC, Martin, who has been here, and AMREF has supported us enough to have the school health clubs in work. And out of the 7 members that we have, at least 4 are girls. And now, to initiate that thing, over 6 schools that I know in the district have been brought on board. When it comes to the task force, so the task team, the chairman LC5 talked about, I'm one of the members, but most of them are women.
So there is progress.
I can quote some of them where I'm seeing like Cecilia, I can see my Anna, I can see. So that's why
Asaba
I'm saying
Shadrach,
that
thank you so much. He's a water user community representative, and indeed, thank you for that information. Bruno Basude, a district water officer. Mr. Bruno Basude, please take over the podium.
Thank you, Mr. Speaker. Good evening, all the viewers. As Kabarole District under the Water Office, we noticed that the challenge mainly comes from operational maintenance. Because before construction of these water points, we test the quality. The quality passes the test.
Indeed.
But due to poor operational maintenance, these water sources are affected. You have heard from the statistics of sanitation.
Indeed.
They are telling us that 76 are advanced levels of sanitation.
4.3% only are advanced.
4.3, meaning that other percentage, the 8% you talked about with who have no access to toilets, that is open defecation. So that one is the big cause of the water quality destruction, or the water that affects our water quality in the district. We have a rehabilitation fund, and the ministries are advocating for private operators to see that they are operating these water systems. Because we have been working with water boards, water user committees, but these committees are facilitated from the communities. And the facilitation is not continuous. So at one point, when the water is functioning, people tend not to pay, and they wait when it has broken down, that's when they pay. And going back to the theme of today, how we are involving women, or how the water sector is working to improve or to reduce on these hours lost by women. As a district, we have, in the past, actually most of our water sources are water points, that is shallow wells, boreholes, and springs. But we are moving from water point sources to piped water systems in the district. And as earlier my chairperson has already communicated, the area that came up in Kichwamba, that is Hara, which is not served, and the district has allocated 217 million this financial year, 23-24, which will address that concern.
Right.
And we also have the umbrella, which is responsible for operation and maintenance in Kichwamba sub-county, which we are partnering with, so that after the district has constructed, the umbrella takes over the amount of operation and maintenance, and those other main areas that will have been left out for those other extensions to be covered.
And finally?
We have also partnered with National Water as a district, because our grant does not allow us, we don't have funds for operation and maintenance. But National Water has those funds. So we have worked with National Water, and they have taken on areas like Kijura, Kawende, where we have extended water. They do the operation and maintenance of these areas, which which stops our women now from spending a lot of hours fetching water or looking for water in those other open water sources.
All right, thank you so much, Mr. Bruno Basude, the District Water Officer for Kabarole District. I'm sure you do have recommendations. Later on, we are going to call on you to give us those pointers. At this opportune moment, allow me usher in Atuhaire Immaculate. She is a water officer working with the Ministry of Water and Environment.
Thank you, Mr. Speaker. I'll start by informing the People's Parliament with the good news that as the Ministry of Water and Environment, everyone has been talking, we are having bad water. I want to inform them, like, as the Ministry of Water and Environment, we do water quality analysis. You don't need to travel to Kampala to take your water samples to be sampled. We have a regional laboratory that does all that. You can access us. Our offices are just here in Nyabukara.
So indeed, 76.6% of the health facilities in Kabarole District have limited access to sanitation, and those are the statistics that we have. What are you doing as a Ministry of Water to ensure that this is a thing of the past?
As the Ministry of Water and Environment, we do and believe in partnering with our different partners. And in this case, I would like to appreciate some of our partners like IRC. I've seen Mr. Martin being here. During the last Water and Environment Week, we were able to open one health center in sorry, I've forgotten the place, but we were able to open this health center, and it was well equipped with the water source. So that's what the ministry is doing. And as the ministry, we also enhancing our budgets to make sure that the whole area is covered with access to safe, clean water.
And indeed, what are we doing as a Ministry of Water? Because we have herders bringing in the animals to the same water sources that are used by people like Stella Kajoina at the end of the day. Yes, so what is the Ministry of Water doing to enforce and, ensure that this is a thing of the past?
Thank you so much. The Ministry of Water and Environment has embarked on integrated water resources management. This is whereby we are developing catchment management plans that identifies the different challenges that are faced in a particular catchment. For example, in this instance, I'm going to bring out our Mpanga management plan, where Honorable Richard Rawinga is the chairman. We prepare these management plans. We bring all the stakeholders, like in such a forum. What can we do? Which role can you play? Where can we work together? Because we believe in managing these resources, we must work together.
And of course, we do have a district speaker in our midst who's going to be sharing with us the gender perspectives on WASH in the district council. Please take over the podium.
Thank you,
Glad
Mr.
to have
Speaker.
you.
Good evening, viewers and participants in this parliament. As a district council of Kabarole, we emphasize very much on WASH, and that's why we went a step ahead to have a master plan in place, and that is our guiding tool as Kabarole District Council. We have not stopped on that. We have gone ahead to put in place an ordinance, which is in place as well. So as Kabarole, we are emphasizing very much.
What is the role of the ordinance?
The ordinance helps the community in the sensitization, in maintaining the sanitation, having water sources being maintained, having the sanitation in place, So all that is maintained in the ordinance.
What does the ordinance say about culprits who bring the animals to the same water sources
Well,
as the community members?
as the district council, our role was done, so it is at the level
Of
the,
enforcement.
not at enforcement. It is at the level of the Solicitor General. We are waiting for the input of the Solicitor General, such that we can have it in place.
Of course, I have my statistics here, and they're saying that culture also plays a big role. Culture that says, you know what, it's the girl that is supposed to go to the well, fetch water, and then the boy is supposed to stay home or handle other issues. So in your sensitization ventures, have you actually ensured that you break the barriers that are being brought about by culture?
Of course, as a district council, we also passed a bylaw, let me say, whereby we have the Brungiwansi. So yes, Brungiwansi, that is community work, communal work, whereby the locals will gather at a certain water source, they clean it. That the work is upon on the open water sources, if at all they are there.
Government provide enough information about the systems of what they are going to construct, because most of our people lack information. If when the umbrella come one day, they come and start constructing without informing the general public how to use it and how to maintain it. Water harvesting in our area, so as to help government also ourselves to have enough water.
Mr. Menta, thank you so much. Gentlemen?
A very good evening, our viewers.
Your name?
Tom Hairo Trevor.
Trevor, okay.
I'm working with KRC as a youth champion. And we are working on a project called Young African Works, Markets for the Youth. And we had to do what we call YLR, that is a youth-led research. And basically we did it on water and sanitation. So, and during our research,
what did you find out?
We found out that 64% of people living in Karangura sub-county get their water, 64% get water from flowing rivers. For instance, in Kanyamura, that is a village. And 34% get their water from rainwater.
64% rivers, 34% rainwater. Go ahead. I'm following.
And there is tap water, that is 45%. They use tap water. And we finally found out.
I'm waiting for the recommendation part.
And we found out. And we found out that these people walk, 78% of these people walk above a kilometer to access the water.
So what is your recommendation?
I recommend the government at least construct these schemes to these people, because they have the sources of water, that is the river. So at least if they can construct a scheme where they can get that water and treat it for community consumption.
Thank you so much, Trevor. And indeed, Honorable Richard did mention that they are going to be focusing on piped water for the home states. Indeed.
If they can provide information, we would have loved to have some clarification, because if 64% of the population
are using river water,
34% are using rainwater, that is 98%. Then where do we get the 45% that use the tapped water? Because that goes to 150%. I got lost somewhere.
My name is Twahiro Anna. I work as ADHO in charge of maternal and child health, Kabarole district.
Yes.
And my first recommendation is, at least if the government would waive off the tax for donor funds, which support in wash and sanitation, sorry. Then another recommendation, as a maternal and child health officer, I request if we could have at least all our facilities have menstrual hygiene facilities, as most of our facilities lack menstrual and hygiene facilities. As the director said, that menstrual and hygiene facility is one of the requirements for a proper hygiene site in our facilities. And like how the condoms have the condom dispenser, we request also in our in our menstrual hygiene facilities, we have those dispensers for pads. Because if every corner has a condom dispenser, but you cannot identify. Yes, condom dispenser, you know the condom, eh? So we need a pad dispenser in every corner.
Your recommendation, sir?
My recommendation. First, let's begin by ourselves. Our sanitation at home. First. Secondly, to teach people to harvest water. Since we are blessed with a better climate, it's raining throughout more or less the whole year. Thirdly, I'm requesting the government if they can reduce or scrap off the tax on all water-related materials. Thank you, Mr. Speaker.
Thank you, too.
So we need to protect the sources so that water is available. We need to make sure it is transported and is accessible to the people. And once it's in people's homes, it is utilized properly and ensure that it doesn't have any fecal materials. So we need mindset change when it comes to utilization of water.
All right, thank you so much, gentlemen.
The other
And we go
aspect
home.
is we need to increase funding for water.
And many thanks to each and everyone who has participated in this edition of the People's Parliament. It has been the most vibrant session of the People's Parliament. Of course, I didn't even want to wrap it up. Of course, we have to leave, but of course, let's wrap it up with Jane Sembuche, the Country Director for Water Aid Uganda. She's going to give us a few remarks on the advocacy policy or outlook for Water Aid Uganda for the next 5 years. Go ahead.
Thank you very much, Speaker. As you said, it's been quite vibrant.
Indeed.
And I really want to acknowledge the voices that have come out. I want to commend Kabarole District Chair and his team for all the work that they've shared they're doing. Yes, there's still more that we need to do, and we need to do it together.
Indeed.
I think for me, in terms of the way forward, one thing that I really want, not just Kabarole, but across Uganda, for us to be able to realize, WASH is becoming a public health concern. The lack or inadequacy of WASH should be a public health concern across all our districts and across the nation. Why do I say this? If not a concern, even a crisis. If we're saying 75% of the disease burden can be eliminated or significantly reduced by providing adequate WASH services, then what is it that is preventing us from prioritizing this right from the national level, where our parliamentarians are passing budgets for different sectors? We need more for WASH. So for us as Water Aid, our call is, this is a challenge, this is a problem. Let us prioritize it across everything that we do, because when you talk about WASH, you can't separate it from economic development, you can't separate it from education, you can't separate it from education. It is integrated across. So that is our plea, and what we are always going to be talking about. Because at the end of the day, we feel that by doing that, not just us, but across board, with the voices, with leadership that is aware of this, we can be able to overcome this challenge. Thank you very much.
And indeed, thank you to Ms. Jane Sembuche, Country Director, Water Aid Uganda, and of course, the People's Parliament Kabarole edition can't go any further than that. I'm Romy Busuku, and I've been your speaker for this session. And indeed, that's it. My name is Romy Busuku. Till we meet again, have yourselves a blessed night. All rise.